Well, doctors are worried we could see a twin-demic this fall with COVID-19 and the flu both circulating at the same time. That twin-demic never materialized last year, but this year is expected to be a different story. NBC4's Angie Crouch has more on keeping your family safe.
We did not see as much influenza. We did not see as much respiratory syncytial virus until we started opening.
Infectious disease doctors say last year we saw very few cases of flu and respiratory syncytial virus, known as RSV, since many schools and businesses were closed. But now people are mingling more, and since both COVID and influenza cause similar symptoms, doctors will need to test for both.
If you are feeling under the weather, go home, quarantine yourself until you know what it is. It's going to make the biggest difference going forward for this flu and winter season.
Flu season typically runs from late September through the winter. The flu causes between 1,000 and 1,900 deaths each year in LA County. That compares with 25,000 COVID deaths in LA County since the start of the pandemic. Infectious disease experts say this is why everyone should be vaccinated against COVID and now also the flu.
People need to have the vaccine before the beginning of November, so that when the coldest months hit and when the flu season is maximal, that's when you have the protection.
Some immunocompromised people have already gotten their third COVID booster shot. Boosters could be approved for the general public later this month. Doctors say while there's no evidence getting a COVID and a flu shot at the same time will harm you, you may want to space them a few weeks apart.
If someone is worried about side effects, and if you take both of them and you have a side effect, you wouldn't know which is which, then perhaps, separating them out may be not a bad idea.
Now, flu shots are FDA approved for everybody over the age of 6 months. You can get one at your doctor's office or pharmacy, and many public health clinics offer them free of charge. Reporting live, Angie Crouch, NBC4 News.